كل عام وأنتم بخير وتقبل الله طاعاتكم. ولكن بداية ببالغ الحزن والأسف نبلغ أصحابنا وأهلنا في لبنان تعازينا على ما أصابهم وندعو لهم إن شاء الله بالسلامة والأمان بإذن الله. I am Dr. Huda Al-Duwaisan, consultant family practitioner and the head of Yarmouk Health Center and also the chairperson for primary healthcare faculty. First of all, I would like to thank the Arab Public Health Association in collaboration with the WHO Collaborating Center in the Imperial College in London for giving me this prestigious opportunity to share number 11 COVID-19 webinar. And today it's about the media during COVID-19 pandemic. Just give me 1 or 2 minutes just to share with you just general public thought about the media and the COVID-19 pandemic. With the emergence of a social network, especially as a source of information in this critical situation, and the information environment has become really significantly more complex. Today, people are faced with abundance of information, as you can see, from various sources. Some of these information are promoting credible information, or some of these media are promoting critical information, but others are promoting non-credible or even not evidence-based information. And some of them, they have misinformation, while some of the media information were limited for forwarded in the WhatsApp and also restricted. But conspiracy theory and labeling contents are mastering the media information nowadays. As a result of this, high-ranking officials from the World Health Organization, WHO, have recently spoken about the need to fight not only COVID-19 pandemic, but also related infodemic. As I said, what I have told you before is just some of the general public thoughts. But I'm sure that our speakers, and actually I think we have only one speaker now, will go into more detail in all aspects. So we are pleased to invite our distinguished speaker today, Dr. Hassan Al-Khudairi. Hassan Al-Khudairi, he is consultant general surgeon, broadcaster and writer from Kingdom Saudi Arabia. Also for discussion panelists, and also we were waiting for Dr. Ahmed Al-Rudaini, but I don't know what happened for him. Hope everything will be fine. He's a family practitioner, ex-spokesman for the Ministry of Health from Iraq. Also for our discussion panelists, we have our famous Arab board hero, Professor Salman Rawaf. He is the board president. Our speaker, they are going to talk for 15 minutes in each presentation. And for the audience, if you have any questions or any comments, please write them in the chat area. And after the presentation, the speaker will answer all your query, hopefully. And please, I urge all of you to mute the microphone, please. And now the microphone ready for our first speaker, Dr. Hassan Al-Khudairi. You are most welcome, Dr. Hassan Al-Khudairi, and the microphone is for you now. مقصود. ما في صوت دكتور حسن.
الو تسمعوني الحين؟
Yes, yeah, good. تمام. الحين لا. من ساعة كان في صوت.
ودحين؟
انزين.
اوكي كويس؟
Yes.
ما ادري تبغوا تتكلم عربي ولا انجليزي؟ انا انجليزيتي ترى مو زيكم ما شاء الله تبارك الله.
Mixed, مو مشكلة.
Okay, first it's my pleasure to be with you. Actually, I'm a consultant of obstetric and gynecology. I'm a consultant of palliative care at King Saud University. I'm working with media, Prof. Salman, Prof. Tawfik, they know me. I work with them many times. If we talk about this corona and media this time, actually I can say it's not a virus corona, it's media virus. It's occupy all the media during the last 6 or 7 months. Media play a big roles in this pandemic disease. Maybe some people get sick because of media more than the virus itself, if I can say like this. There is a report from many governments and many places that more than 53.6% of the world population, which is more than 4.1 billion of people, they use the internet during these 6 months. And in India, only more than half of their population, 560 million, after China, second country after China, which is equal about 71% of people who's using internet. In European country, this is only about net or about social media and how they use it during Corona. In European country, more than 50 in 2014, before Corona, more than about 60% of them, they use the internet. So internet now is, or social media is essential in our fighting our education about Corona. A lot of things we have to do, but we have a problem with there's no specialized people in this field. Media make people scared more from Corona, more than Corona, maybe sometimes. Corona is present, there's Corona, there's a lot of problems because of Corona. But media in some areas make it more than just a virus or more than Corona. It becomes, after some times of talking about Corona, there's the trust between the public or the people and the media. It's become not that good. People does not trust the media. For example, during the using of chloroquine in treatment of Corona, first it's good choice. With Trump come out and said it's good choice for Corona. And then after some weeks or some days, another study come and said it's not good. And then after that, they said, no, we have to go back to chloroquine. They use everything. Plus, with the media, there's a lot of people who is not medically original, not doctors, not working in medical field. They start using social media just to get more followers. So they bring news, they go to scientific papers, they translate with not good knowledge and just publish. And people, we are, احنا في العربي نقول زي الغرقان يتعلق بقشاية. Everyone is looking for any information. We don't have, during the last 6 or 7 months with Corona, we don't have built any rules for people in media to work with Corona. So it becomes anyone can go and talk about Corona. This is get bad results of population. They don't trust the doctors. They don't trust the media. They don't trust Corona. And in the other side, a lot of people talk, it's not Corona, it's political. It's economical issues. It's just a virus from China. They want to control the world. It's fighting between China and America. It's fighting and so on. So no one trusts and no one listen for that after that, except if the person get one of his family sick, now he start to believe that there is a Corona. We don't find a good source or a truth source, masdar حقيقي or masdar trustable, so we can trust him and listen for media. We have good experience in Saudi Arabia. We just put a Ministry of Health is the source of information. We don't believe anyone talk from outside. So we told all population, please, if there is no information from Ministry of Health, don't listen. Even Hassan Al-Khudairi, he's working a doctor. If he says something in social media, we should not listen for him. Go and listen for Ministry of Health. It's the only source, and 937, and we give them the map or the guidelines how to deal with this. We need to succeed in this pandemic disease. So we have to make good group of media people, but unfortunately, most of the countries, they don't listen. We are just listening for the TV. you know, media all the time, they need followers, they need ithara. So everyone will follow them. If they go with bad news or good news, we are following them, unfortunately. Rumors, it's the whole environment, the whole sky is full of rumors. Even we don't know what is the truth and what is the non-truth, what is which we should follow and which we should not. We don't have good experience. If we are talking about flu or influenza, the only one which happened pandemic was 100 years back. We don't have enough information about it. So now we get new experience, new experiment, new field. So we have to think how to follow the news and how we trust. So if anyone come and said, even Dr. Huda, if you follow the medical or journals, which is only for doctors and scientific journals, they put research which you can't study. Sorry, you can't trust. They publish one paper, and after sometimes it's truth. It becomes money. I receive a lot of emails daily that if you have any paper, just send $150. We will publish it for you after 1 week. We have next week is the last week, so please send. So how I can trust these magazines after or journals? This is the problem. In some studies with some institution, media institution, in the beginning in March, more than 90% of people in Italy, Japan, Korea, they listen for the news at least once daily. Some of them more than one time. So their source of information is the official, non-official or non-medical media. This is make everything upside down. Some people, they go for نسميها الصحافة الصفراء, which publish, for example, in the beginning that these viruses come because they take soap of خفاش, السوب حق الخفاش, وبالتالي انتشر البيبل and people start believing that. So nothing trustable except some countries which make the media or the source of the information from one places, as I said before, like Saudi Arabia, Ministry of Health, and some other countries. That's what I think. If you have any questions, it will be my pleasure.
Thank you, Dr. Hassan, for this presentation and informative presentation. Dr. Rawaf, you are with us?
Well, thank you very much, both of you, Dr. Huda and Dr. Hassan, for the excellent platform which you put for us. I mean, let me first give apology that Dr. Khoja has to travel for family business in the last minute, family issue. And I didn't receive anything from Ahmedmundry, family physician and this ex-spokesman for the Ministry of Health of Iraq. I hope he's okay, and I'm a bit worried that he may have something wrong. He's an extremely reliable person, like Dr. Hassan and Huda, and I'm really hope we are trying to contact him. I think, first of all, let me start by giving our sympathy and condolences to all who lost their life and their families in Lebanon, and for the 300,000 people who lost their livelihood and living, and they are actually without any shelter, and the damage, extensive damage in the city. Unfortunately, we don't know the details of the cause officially. We have various reports from various organizations, and since we are talking about reliable news, we should rely on the official story, not emerging stories. So it's a major public health disaster, and our heart and soul with people of Lebanon. And we are extremely grateful as an Arab Public Health Association to all Arab countries, all our brothers everywhere in the Arab world. They are actually stood by their brothers in Lebanon immediately. Every single government responses were extremely positive and welcome. And also we are extremely grateful to His Excellency, Dr. Ahmedmundry, Regional Director of WHO IMRO, for his commitment and immediate action, directing, despite the pandemic and how much busy they are, the WHO resources to address the need of our people in Lebanon. This is a huge disaster, a huge event. This is the second largest blast after the nuclear blast in Japan, which is really, in terms of magnitude and possibly the damage it caused. Nobody knows the extent of the damage, but it was felt almost in every corner of the country. I mean, we have with us, you, the two experts, and let us go back and revert to the media issue. I think if I start with the platform, now that we are only three, which is make it more condensed discussion, and I will capitalize on your extensive experience. Dr. Hassan, as well-known broadcaster, and he got regular TV program, as well as superb writer, and I know him for many, many years. And one of the excellent communicator, actually, Dr. Huda, as a family physician and leading one of the good services in Kuwait, but also she is leading across the Arab world. Again, I know her for many, many years. And we know how much that communication issue, whether it is an internal media, i.e. within conferences and meeting and groups, or the external media communicating with the public. The issues to me, and I'm not trying to bridge the gap by giving a lecture, but let me address some of the issues in the way we receive it within public health in the UK and public health movements across the world. If you look at the media issue, that we can classify what happened in this pandemic, as Dr. Hassan said, it's unique because in the past, 100 years ago, we didn't have that sort of media. And the sources where the information used to be received, most probably a notice, they stick it on the wall and people come and read it. Most probably that's the best source of media at that time. I think we did have by now a big revolution. Until now, we don't know the extent of it since 2012, which is the introduction of the smartphone. What happened during this pandemic is unique. All of us are actually surprised. I know in several meetings of WHO, whether the Technical Advisory Committee for COVID at IMRO, whether with meeting and colleagues in Geneva or meeting across the various public health associations around the world, we are actually taken back and surprised by the amount of information which are misleading information, confusing information. And we don't know how much of these were innocent and how much of these were deliberate and how much of these were more than deliberate, malicious, just to cause harm. But if you classify these, I can't put it into possibly three groups of information which communicated through the media. Mainly the TV channels and radio, but most importantly also the social media, because the social media is almost everyone carrying his telephone or iPad anywhere, everywhere. You know, I mean, I know that people, I don't exclude myself, you know, because of the busy time, we take the iPad or the telephone most probably to the bathroom, to everywhere in the corner of our houses, you know. So we tend to respond very quickly and receive information very quickly. I know some people even don't watch television, but they watch Hassan Al-Khudairi, for example, on WhatsApp, because he is so good in communicating that through WhatsApp, and we receive the link and just clicking at the link, and you go and listen to his beautifully for 1 hour, you know, easily. So let us classify these things. And in my classification, these could be, possibly it goes into 3 areas. I mean, I'm just thinking about it. I mean, we expect that most of the information will be class 1, which is factual, i.e. people getting information. And the 2 sources in this pandemic of factual information are coming mainly from WHO, which is the main organization, bilateral organization with the mandate for health globally. And no other organization have such a mandate for health except WHO. And we are proud of their work and achievement. The second source of factual information is coming from ministries of health, because the ministries of health, again, rely on their information from their international sources, because all of us with this new virus, with a new dynamic, learning at every step of the development. And I think this is really important to remember, that until now, I think, and this is repeated several times, even the last few days, by many scientists around the world, that we don't yet understand fully this virus. So the dynamic is changing, and therefore we expect changing in information. And unfortunately, some of the doctors and colleagues immediately jump on the wagon and say, look, WHO changed their mind. The example which Dr. Hassan used for hydroxychloroquine, you know. But science is changing because evidence is changing. The dynamic of the virus is unique. We never seen anything like that in the history of medicine before. So that's a group 1. I mean, the second one is really, I would say, it falls with the non-factual information, you know. And that group of non-factual information tend to be, unfortunately, I like the things which is called fake news, you know. And there are a lot of good reasons for the fake news, you know. Some of it political. We have seen some countries deliberately use fake news to mislead the public. I'm not going to mention these for very, very well-known reason, but we know there were political motivation, and we see it in many countries around the world, and we've seen the scientific communities in these countries disagree, for example, with the leader, with the president, with the there are some people, which is mainly from our profession, they try to show off that they can actually communicate with the public. And the only way to appear on television, because they don't have the charismatic attitude of Dr. Hassan Al-Khudairi or his beautiful appearance. So they come with the news, you know, any news, just to get a slot somewhere in the television, you know, maybe with you, Dr. Hassan, or with Dr. Huda, or with Dr. Al-Rudaini, so something like that. And we have, unfortunately, within our medical profession, as you said, Dr. Hassan, non-medical profession, the attention seeker, you know, people just, they want to capture something, you know, and we've seen it in many countries, even on the formal media. And we see it in some countries that those people actually were punished by their regulatory body. I again will not give details, but we know of a case in United Kingdom, when a doctor appear on television talk about actually medication with some criticism to his colleagues, immediately was barred by the General Medical Council. So there are examples from other countries around the world. And the other group, which I can classify them as just capturing opportunity. They are not intentional. They are innocent people. But if he or she appear on television, I need to say something, you know? It's simply this, under this sort of slogan, I need to say something. So I have to say something, although I'm not expert in corona. I'm not an epidemiologist. I'm not a public health person. But when they ask me a question, I try to answer. You know, there are people in our profession, they found it extremely difficult. When they are asked questions, they said, excuse me, this is not my specialty. You know, forgive me, I can ask somebody else. I know he will be better to answer this question. So they answer the question which is given to him and use it as an opportunity, but unfortunately misleading the public. If you take the third group, you know, it's almost between factual and fake. You have contaminated information. Somebody, he knows this is factual, but at the same time received information which is fake, and he tried to combine the two. And I've seen this actually, especially the last a few months, the last couple of months, when we were talking about treatment, when we were talking about whether the condition is transmitted through this method or that method, whether using a mask will prevent the spread of the infection, etc. I think if we take all these together, we are in a situation, and one of my colleagues recently was saying to me, he said, honestly, it's almost 90% of the information circulated in the media. 90% is most probably not reliable. And unfortunately, our clinical colleagues in the last few months, they started, even with factual information, misleading the public. And I give you an example of this. You know, the example of this is when people appear on the television and they talking about a treatment. By the way, we don't have any treatment, any new treatment for the virus at all. Therefore, we don't have a treatment or intervention to prevent somebody getting the virus. We don't have any new intervention to treat the virus among mild cases. We don't have any intervention to treat, a new intervention to treat the virus or COVID itself once the disease had happened and the patient admitted to the hospital. We are using treatment which is tried before, okay, like antiviral, like actually steroid and oxygen therapy, plasma therapy, and many other things. Most of these treatments are supposed to be used under actually the umbrella of clinical trial, i.e. with the consent of the patient, informing the patient that this treatment is for a trial. So let me give you this scenario that many of my colleagues, the clinical colleagues, ignored the fact that this is a public health issue. The focus should be on transmission. They start talking to the public in one country, you know, I will not name it now, you know, they were talking about the Russian therapy, you know, and they give the impression, a misleading impression, you know, to the public that don't worry if you get the infection because we have the Russian treatment. And this is the most dangerous aspect of public health, because this pandemic is not about the treatment. You know, this pandemic about the prevention of the transmission. The way we are flattening the curve and abating this infection is by simply preventing the transmission. And the public health measure to prevent the transmission is extremely well known to all of us. Instead of talking about how people should prevent the transmission, how people should really recognize the early symptoms which make themselves isolate themselves at home, you know, where 80%, maybe 85% of the population get that infection, and once the symptom appear, sitting at home, relaxing, taking simple remedies, make sure they don't contact other people because they are isolated. This is how we cut the transmission. When we ask the public around the world, including United Kingdom, what are the 4 symptoms, main symptoms for COVID-19? Majority of people didn't know. Why? Because clinicians were very keen to appear on television talking about a treatment, flexing their muscles about a treatment which never existed, you know, taking huge amount of risk. I mean, by the way, almost the majority of our medical colleagues in public health and clinical medicine doing fantastic job around the world. And our Arab countries doing fantastic job. Many of them sacrificed their life for the benefit of patient. I'm not aware of any country did not lose a number of medical, nursing, and other colleagues for their fantastic commitment. But here we are not talking about those people. Majority of them are silent majority, doing their job on daily basis in a beautiful way. I'm really talking about the people who, as we said, showing off or capturing opportunity or communicating or trying to be in the media, transmitting this sort of information. I want to go again to this point and saying that the majority of the public don't know what are these 4 symptoms. Yes. And if you ask any job log in the street of Baghdad or the street of Riyadh or the street of Kuwait City or indeed in Damascus or Casablanca, I doubted that they know what are these symptoms. And this is really the message which the media should focus on. How do you recognize these symptoms? And the 4, of course, as you know, the first one and the most common one is change in smell and taste, which wasn't, by the way, at the beginning identified as an important symptom. But now we know it as important symptom affecting the majority of the people, and sometimes the people get it as the only symptom. And this change may last for a long period of time, by the way. And the second one is, of course, the well documented is the fever. And the third one is constant dry cough. And the 4th one, which is affecting a small number of people, but sometimes it's the only symptoms, which is actually dyspnea, which is actually they feel shortness of a breath, you know. And if we understand these 4 symptoms and using the media to communicate it, we would save a lot of life. We would have prevented a lot of transmission. We would save our health services, and we will keep people healthy. But I think that message, and I hope some of the people, some of my colleagues in public health and clinical medicine, listening to this and communicate this. My good friend Gabrielle Scali, which was regional director of public health here in the UK, appeared on television the other day, say, I'm really very crossed and upset that we didn't give enough information to the public across the world about what are these symptoms and when it appear, what should I do?
So that's what, sorry, Dr. Rawaf, to interrupt you. So that's what, let me summarize what you have said. And thank you very much for this detailed information. And thank you very much, Dr. Hassan, for the informative lectures. Just let me summarize what you have said and conclude what you have said from the talk previously, that most of the people now, they are following the media. So at all age level. I mean, even the elderly, if they are not following the media, they are taking the information from their children who are following this media. So now most of the people, they are following the media. Second thing, now you all agree that the information from the media, 90% of them are not good information. Let us not avoid saying fake or something, not beneficial information, and only maybe 10% of this information are of benefit. So my question will be, what is the consequence of this on the mortality and morbidity of COVID-19 on the patients and the population in the whole world? Dr. Rawaf or Dr. Hassan?
Dr. Hassan?
Just let me, one of my articles, I wrote one article, it's in Arabic, but I will try to translate. We said, if this virus kill many people, not because it's strong, because of our low immunity due to wrong and rumors, which we face every day. We are looking for media. Everyone, as Prof. Rawaf said, everyone has his mobile, even in bedroom. Azakumullah. We are opening all the time looking for news. If I write now one rumors or any write that Prof. Rawaf discover a new vaccine for coronavirus and send it. I know it's liar. I'm lying. And send it. After 1 hour, it comes to me and I will believe it. With WhatsApp, I will believe that. So the problem with a lot of people will go not low immunity, they will be suffering from the rumors and wrong and no information. As Prof. Rawaf said, we don't have the basic things. We are jumping for the vaccine. All of the world is thinking about how we can get the vaccine, when we are going to get the vaccine. No one think about simple things which some countries follow, like distancing, like wearing mask, like preventive. Our problem is since more than 100 years, we think about treatment, not preventive, no preventive medicine. I remember Prof. Khoja, Prof. Rawaf, all of them fighting for preventive medicine, but no one listened. So we have to go back to know the basic things, to know what is the virus, to know what is the symptoms, to follow the preventive things. We don't need the vaccine at this time. Vaccine still, maybe it will take a few months, a few years, maybe many years, maybe comes, maybe not. And even if they bring vaccine this year, next year the virus will change its consequence and come with other things. And we are following new rules. We have to go and find a new vaccine and so on. Like our normal flow every year. We get vaccine, but next year we have to get the vaccine again. So why we don't follow the preventive medicine? Why we don't apply preventive medicine and make all media concentrate on these issues? Go and teach people how to protect themselves from the virus, from the infection, from colleagues and friends. Stay home, stay in the street in safe side. Everything we do it in preventive way will be better than searching and looking for vaccine and wasting a lot of times. Just think, when is the vaccine come? And vaccine is still in the hand of America. It will not give us. They want to kill our population. They want to kill the Chinese. They have big fighting with China. And these rumors, which we should not think about it. We should think about our health and how to prevent the disease before it comes to our home.
So you are saying that the people, after following this media, following it to that extent, it gave them negative effects on their social life, on their holistic life. That's one. Second thing, they are following this media and they are not having the reality or the truth behind this media, and that direct them to manage themselves wrongly to some extent. And following this media put them under stress, and they may go into more mental health problem, and anxiety and depression. And the anxiety and depression per se, it will decrease their immunity, and it led them to be more exposed to have this infection. And so with all of these things, and also following this media, although the media, most of the media, they are telling them about the prevention, but we can see that the people that are not following the preventive procedure, which was done, given to them through the media. So what's the benefit of the media now from this? If it is putting them under stress, if it is direct them, if it is decreasing their immunity.
Okay, maybe Prof. Salman knows better than me. If we look for the Arab countries, let's say they are 1 billion. Count for me 10 media people who is educated healthily. They are concerned about health. You will not find more than, even if you want 5, you will not find. Okay, now let's say about Arab countries. No one. In the Western, every newspaper, every TV channels, they have one medical journalist. He is specialized in this field, and no one can talk. But here in Arab countries, the head of the channel can speak. The layman can speak. Everyone can speak about health. Okay, for example, in some countries, if you talk about religion, you will go to jail. If you talk about political, you will go to jail. But if you talk about health, whatever you want to say, you can say. You can say anything. Am I right, Prof? Salman? Please, I don't want to into that jail. Let me.
Yeah. I know, no. You talk about health, you just certainly don't go to jail. Don't worry. But I think your point is valid. But let me. I'll come back to this point. Let me address the previous question from Dr. Huda. And the question is extremely good. Can we estimate the morbidity and mortality which may be associated with the fake news and misinformation? I tell you, it's very difficult, and maybe in the future there will be some studies. Hopefully colleagues will look into that. But for certain, I'll get you 2 examples which may be useful. First example, which I found it so much damaging, and I said that on the media several times around the world. The first example is United States, where actually the president appeared on television and said to the public, I used hydroxychloroquine for prevention, and look at me, I don't have the virus. While the team around me got the virus. That was the wrong message. Immediately, the people from CDC and Anthony Fauci appeared on television and said, that is not helpful message. They didn't say wrong. Nobody can say to the president wrong except us here in the Arab world. Again, we don't go to prison. But that to me is so much misleading that the public actually trusted, and they have the right. I mean, if it's my president, I will trust him. They have the right to trust their president, and therefore gave the wrong impression to the people. And if you see the number of cases now in the United States, represent about 1/4 of all the cases, more than 1/4 in the world. And mortality is over 150,000, all right? The second example was a member of the Iraqi parliament, and I mentioned him in the Iraqi media several times, appeared on television. He said, I'm expert in public health, I'm qualified in public health, I'm a doctor, but let me tell you, there is no coronavirus. This is a political virus, and gave the wrong impression and the wrong message to the people in Iraq. And all of us were critical of that statement, highly critical, actually, openly critical, because that gave such a misinformation that the people until today believe in Iraq. Some people, unfortunately, that there is no coronavirus. And this is simply people are restricting us from our normal living, our livelihood, and religious activities, etc., etc. So these are simply examples. And let me come to you, Dr. Hassan. Again, you raised a very important point about the number of people with medical background appear on the media. We have great difficulties we identified you very easily, and Dr. Ahmed, and we wanted to have more people in this program actually for today's meeting, which is well-known doctors in the media. And really, we couldn't identify many in the Arab world. Well, for example, in the CNN, you see the chief medical correspondent is well-known doctor, Sanjay Gupta. You will find the BBC, they have a number of medical correspondents who are doctors. And by the way, they are family physician, you know, because family physician, to be very honest with you, and we are extremely proud of family physician around the world. Family physicians are one of the best communicators, and they are good communicator by the nature of their job, and they deal with us in holistic way, and they can answer any questions related to physical, mental, and social well-being in a beautiful way, because this is part of their training. So yes, you are right. Yeah. We have also questions, a few questions, you know.
Yes.
Is there any mechanism to sanction? I mean, this is a question appear, I mean, both of you, and I'm happy to, now there is a gap in our program to come in as well. Is there any sanction for people who are misleading the public across the formal media and the informal media? That's good classification, by the way. Yeah. Dr. Hassan?
Yeah.
Dr. Huda.
No, it's okay.
No, let's first.
Huda.
I think we are lacking a system, very well defined system to organize this issue. And when I'm talking about the system, I'm talking about a strategy, clear strategy that can be followed by the whole area to control this. And that strategy should be supported by policies. And these policies should be a good policies and strict policies. If you deviate from here to the left or to the right, you will be punished for what you are doing. And also in the system, not only the strategy and the policies, communication plan. I mean, nobody should be allowed to go and talk by himself on anything. There should be a communication plan in implementing this information and sending this information for the community. There should be a clear guideline toward the information which should be sent or should be demonstrated in the media. And also there should be research, evidence-based. I mean, we are lacking the research or evidence-based people in our area to give us evidence documented information which are suitable to our culture, suitable to our area, because what is implemented in the UK or USA, not necessarily it will be implemented in our area, because we are having different culture. Especially we are talking about a public disease, public health disease, not about specific disease. We are not talking about rheumatoid arthritis, which is just clear and fine for this. No, we are talking about prevention. Since we are talking about prevention, we have to study the culture of the community, and we have to have research and data and analyze them very well, and then we implement from them a good strategy for implementation. So that's what I meant by talking about the system, which we are lacking this system in our area.
Okay, Prof. Salman, I agree with Dr. Huda. We have another issue which is very difficult. Now, the media is not very difficult to control it. It's a space. Everyone, if I write now and you stop me tomorrow, I can come by the name of Abu Rish, Musa, Ali, Yahya, vague name and start writing whatever. And I need followers. And this is unfortunately, which is very bad. Most of people, you remember the story in the past what they said, if you want to write a news, لا تكتب انه الله يعزك كلب عض رجل، لا اكتب رجل عض كلب، الناس كلها حتقرا. This is what's happening now. Everyone writing.
It's sensational, sensational.
Yes. So everyone is going for that. We don't have a truth media, unfortunately, in most of the countries. As I told you before, in Saudi Arabia, they stop everyone, no one talk. They bought spokesman instead of Ministry of Health. So he can talk every day and give the truth and give the guidelines, which little bit control the people who is talking. الذين يغردون خارج السرب. We control them and we listen for that, and they give them 937 to call if anything happening. There's a lot of people in social media, al-mashahir, who can have a lot of followers. So you can bring them, instead of fighting with them, bring them to your side and let them talk with your tongue. So if anything you want, give them the right information and let them spread it if you have good information. We should write a plans, as Dr. Huda said, not only research, a plan for rumors. Okay, if any rumors come, we can. You remember when the virus started, they said this is a synthetic virus. The Chinese people do it in their lab, and then everyone think about that. We will not find and the vaccine is ready since 2003. Since 17 years is ready. Then they said now summer is coming, the heat will kill the virus. الضبان ماتت في الصحراء عندنا والفيروس ما مات. Still going on. So we have to stop all of these rumors and find a plan to ندفنها في مهدها قبل ما تستفحل وتصبح حقيقة. لأنه الخبر لما ارسله البروف سلمان، لو ارسله واحد لي او ارسلته له جروب، حسن خضيري مصدق معناه انه صادق. Unfortunately, most of our people, they believe anything and they resend. We have an issue which is resending. I just today wrote next week article about WhatsAppatitis. WhatsAppatitis, inflammation because of WhatsApp. Yes, we are sending, we are resend. I think every one of us get more than 1,000 message daily resend. You find the same message in different groups. Unfortunately, when it comes from Dr. X, I believe him. I know that he is good, but he is also receive it from other one who trust and so on. So we have to find this. We have to get a good benefit of other experience. Unfortunately, there is no country have good experience. They said Sweden have good experience, but now they start talk about Sweden people and how many people die. You don't know where's the truth, unfortunately. One day they said it's excellent, another day they said no, a lot of people die. So we need to get better experience and get benefit of it.
Well, thank you very much. This is super. I'll come back to this point, which is the plan, because there is a question on this. Let me read a couple of questions from a colleague called Norman Gatriz. I hope I'm pronouncing correctly. His question is, can the media filter the information in a proper way, i.e. some element of control? And the second question related to that, can we prevent, or how we prevent information of no benefit to the general public? Is there any mechanism by which we can prevent misuse of the media, Dr. Huda?
Yes, that's what I said in the beginning.
Yes, I thought
we have 5 things to use in order to control this. First of all, as I said, system. And the most important thing in the system is the policies. سياسات، لازم تكون في سياسات، وهذه السياسات should be implemented. And if somebody is not following this regulation and this policies and causing a problem for the public people, he should be punished for this. And as I said, there is communication plan. You are not allowed to go by yourself and talk about anything by yourself unless you are authorized to talk about it, as Dr. Hassan, he said in his previous discussion. The second thing is the human resource. We should train people for presenting this information for the public, so in a way that they can trust them, and he can communicate with them in a way that he will be trusted, and also he will be listened, and his talk will be they can follow his advices. We don't have good people who are trained for public health problems to talk about this. Don't tell me that we are having one or two. It's not enough. I mean, one or two. You need a committee of good trained people where they can sit together and benefit each other, and then they get out from this with the conclusion, and they will talk in the same language everywhere. So we will trust them because they are talking the same language. We don't have this. Third thing, the external environment. What I meant by the external, the community themselves. The culture of the community. We have to understand our community. We have to understand, and we have to see where is the defect in the community. So don't blame only the people from the health or the doctors, what they are talking about or something like this. Also, the community should be blamed about this, because the community themselves, they may be the source of this information, wrong information. So you need to understand their behavior, their culture, and then modify it, correct it in a way that they can tell something correct. And when you educate them, they can understand it well and they can implement it. The non-human resource, you are talking about the say the iPhone, the TV, and these things should be also under policy where you can control them better. In one area, I mean, all of these equipments, all of this media should be very well controlled by the certain organization. And that's what I think, to control the system, to have better human resource. The non-human resource should be very well controlled. The external environment should be, the community, they should be educated and modified in a way that neither they should send bad, wrong information, and they should implement what they receive.
Yeah. If you allow me to add one point, Prof. Rawaf, you remember we study medicine just for branches: medicine, obstetric and gynae, then pediatric and surgery, then another issues. In primary healthcare, why we don't add, and you are leader in this, add instead, we teach some people ethics. Some people, they are specialized in communication. Why you don't add media and health as a branch and as a subspecialty for people, and encourage them to study this, so we can get at least in every 100, at least 5 or 7 or 10 specialized in media, and their work is doing media and help in media. This will be, after 10 years, we will get a lot of people who is specialized, and we can trust them, and we can give them the riyada. They will be the leaders.
You're right.
We actually, to be very honest with you, we started some years back communication skills for our undergraduate and postgraduate. And I think Huda may remember, we did run a course, for example, Imperial in Kuwait on leadership. And the great element of that is communication skills, because this is the role of a leader. Any leader in any organization, health or non-health, is the ability to communicate. And communication is about the factual things presented in a simple way that the public can understand it. Let me focus on the question we started the question flow and accumulated. We have a question quite similar, and I combined the two from Ahmed and the other one from John. Can we shoulder the responsibility on ministries of the health around the world for not providing accurate and timely information about the pandemic?
Well, I think we cannot blame them, because you see, the COVID-19 is something new, nobody's, something sudden happened, and the nature of it is not very well known, and everybody was confused in the beginning about it. What's this, and what should we do about it, and how to approach it, and how to manage it. So the whole ministries in the whole world, they were confused. صح ولا لا؟
Wow.
So how can you blame somebody who was faced with something unexpected, not identified?
But even, Dr. Huda, even, you see, if you look at some countries, we've seen the Prime Minister, Chief Medical Officer, Chief Scientist, appearing on regular briefing on daily basis, give whatever information they have. And that, despite, I must say, if you take the example of the UK, despite the spread of the virus, because there was delay in taking some of the measures needed, they relied on science and getting the accurate information on daily basis. The politicians standing in the middle, and on their left and right are the scientists. Mm-hmm. So they respond to the question, and that was really quite assuring to the public, Dr. Hassan, can we blame the Ministries of Health? I know you said in the Kingdom of Saudi Arabia, they prevent anyone from talking except from the Ministry of Health spokesman, which is good news. But can you blame?
Well, it depends. We can't blame all the countries or all Ministry of Health, because some countries, they don't have ministry, they have other source of information. We have to blame also, if we want to blame Ministry of Health, we have to blame also Ministry of Information. They share this with the Ministry of Health. But we should not blame, as Dr. Huda said, because they lack the information. We don't know about the virus. Every day we have, when, as you said before, when President Trump come and said, I take a chloroquine, can you want to blame him? No. Then after some times in Saudi Arabia, they stop it from the protocol, and then they returned back, and so on. We don't know, no one. Every day we have a study. Ministry of Health following the studies. Studies, maybe in this, I think I heard more than 5,000, 10,000 studies come in 2 months or 3 months, which is, this is a diarrhea of a study, not studies. Everyone is publishing, everyone is, you don't blame them, and they have no source of information. They are like us, find rules. Even if before we used to take information from Western, CDC also like us. Should we blame CDC?
No.
Okay, CDC, every day they bring, for 2 months, they are guided by Trump. And then they change. Fauci, whenever he see Trump is smiling, he follow him. If not, they fight.
They disagreed with him, by the way, to be fair, both CDC and Fauci, they disagree with him radically, and that's why he marginalized them. There is a question, I'll come back to this point in a minute. There is a question from Professor Ali Abu Timman, Abu Thin, sorry, I always read it wrongly. I'm sorry, Ali. It's actually a comment, nice comment. Through COVID-19 pandemic, a lot of myth and misinformation originated and disseminated well within Western countries. They do not differ a lot than our people when they had difficult situation. So the comment is that we should not blame just only our culture. This is culture around the world. And I think we said it, this is a global problem, global phenomenon. What do you think, Dr. Huda?
Yes, I agree with him. I mean, we are having different culture, and so what they are doing for their culture, maybe it's not suitable to our culture. So why we blame them? It's suitable for them, but not for us. So we should understand our culture, and we should find management for our culture, and not to blame. It's a public thing, but it's different culture.
But to be very honest with you, Dr. Huda, I'll come back to you, Dr. Hassan, on the same question. To be very honest with you, when people facing the same problem, irrespective of the culture, because if you take any countries now, if you take Kuwait, for example, you have couple of million, maybe 3 million of people come from different culture.
Yes.
I'm not talking about a Kuwaiti culture anymore. If you take Britain, for example, you're not talking about the Anglo-Saxon culture, because we have the Arabic culture, we have the Indian culture, we have the African culture, we have Caribbean culture. So most of the countries around the world are multicultural. That purity of culture is no longer exist, by the way. So the universality in dealing with pandemic like this is there. And all the measures which need to be taken, like the public health measures, is universal. There is no culture in saying I cannot wash my hand, or I cannot without shaking hand. I cannot wearing the mask, you know. So, or I cannot use this medication. Yes, maybe one culture will say, look, on religious ground, I'm not allowed to accept the plasma. That's well known.
But usually the people, they change their behavior and attitude in order to adapt to the culture they are living in.
Yeah.
How can they live in this area unless they change and modify themselves? So they will be a little bit diluted in the culture they are living in it. So you will find.
Yeah. Dr. Hassan, your culture is adaptable or not?
We are following the instructions which come from Ministry of Health, because if you see, every day you get a lot of numbers. Numbers becomes, we're scared of numbers, deaf people. And we have also, I'm a doctor, I'm in the hospital, I see my colleague, some of my colleagues passed away, some of them very sick. So we have to follow this. Even if you said in the beginning, we said, no, it's political and economical issues. It's not a health issue. It's just China want to become the first country in the world, and they want to fight with America. So we listen for sometimes, but when we see people die in front of us, no one can think in other way. We have to believe, and we have to follow the instructions. And if we have more than one guide, you will be lost. You have to follow one. As I told you, in Saudi Arabia, we put Ministry of Health is the guidance or the leaders, and we follow them. Even Hars al-Watani, Al-Askari, all of them become under the umbrella of Ministry of Health, following the instruction in this pandemic or coronavirus problem.
You reminded me that at the beginning of the actually pandemic, even before it was declared or labeled or marked as pandemic, they don't call it declaration. It's marked as a pandemic by WHO. Actually, in our Arab Public Health Association, you may remember, I said the only source, please rely on, is Ministry of Health, because I really strongly believe there is no single Ministry of Health will mislead their population deliberately. There is no single Ministry of Health will give insufficient information. There is no single Ministry of Health will not serving its population to the full. I mean, that concept that, and some people, I know some colleagues writing in the social media, unfortunately, cursing their ministries of health around the world, that is wrong. That is absolutely wrong. And I've seen some misbehavior from my colleagues, again, in these sort of accusation, etc. I'm in a group of media and health, and it's a mixture of doctors and media people. And I noticed sometimes the finger pointing to people at ministries, to this and that. But from my working with most of the countries in the region, I really see nothing but goodwill and good faith to help every citizen in that country. We have a question from our good friend and colleagues, the WHO representative to Cairo, Egypt. how can we bring solution and gain trust and reduce the blame in our society? This is from Dr. Naim Al-Qasir. Dr. Huda.
Well, we discussed this previously, I think, and I think the Ministry of Health in this area should have, as I said, shared strategy which is suitable to their culture, the community, and that strategy should be covered by good policies, and these policies should be implemented not only on the population, even in the high authority people, and even in the, because most of the deviation comes from the parliament and somebody like this who is there, no, because of our economic problem, no, for something, no, this policy should be guided, should be implemented on all the population at all levels, and even the authority people. And we have to have research, we have to have data. We are على قولتهم احنا شعب يتكلم ولا يوثق، فلازم احنا يعني we have to
we talk and not document. Excellent.
Yeah. We need to have documents, we need to have data, to rely on this data, and then our talk will be evidence-based. Otherwise, how? Yeah. And then we discussed this before about the training human resource, very well trained on a practice management, on emergency, and how to face these things. Maybe this is COVID now, but we don't know what the future, what will happen. So we have to have emergency plan with very well trained people, how to implement it and how to communicate with the community.
I think we'll come to this in a minute, because I need to ask a question about the second wave. What do you think, Dr. Hassan, about this question? Question from Dr. Naima on the bring a solution.
Well, we are in big trouble now. First wave, we don't solve it till now. We are still waiting for the vaccine. We are still waiting for treatment. And I think Corona, it will not be for just the last 6 months. It will continue for a long time. We are waiting for the next. We are now in summer, and still the numbers increase in some countries. While some countries reduce a little bit, we don't know what is going to happen during the time of flu, which is starting in November, October, December, January. I think if we don't get another wave, we will continue with the same, but more and more. Wallahu alam. Rabbak yastur.
And this is what, just to confirm this, paper published actually in the Lancet a few days ago from colleagues at University College London and London School of Hygiene, Tropical Medicine. And in it they said that if we don't extend the testing and tracing to actually identify the majority of the people who got infection now, most probably we will get a second wave around November, December, I recall, which will be twice bigger than the current one, the first wave, and it will be actually coincided with the flu season. But again, the most interesting things, I think I written this recently in the Arab Public Health Association, saying that what we have in our region, which we notice, and again across Europe, these are not the second wave. We are still in the first wave. We have seen some spikes, and surge. Let me use carefully these terminologies. Spikes and surge in the number of cases, which tend to be localized, because most of the big urban areas, big cities, almost the number of infection reach certain level, but certainly not in small towns. Mm-hmm. In most countries, by the way, in our region and even across Europe. And we started to see more cases in these smaller cities and towns, than in the big cities like the capital, etc. So one need to be careful. There is one question before
Prof. Salman, one thing, till now we spent 6 months or 7 months past. We need to learn from the last 6 months and be ready for the next 6 months.
Yeah. I think this is a very good point. Yes, Huda, sorry.
That is what I'm saying. Same what I agree with Dr. Hassan, that we prepare ourselves better for the next problem.
So we will be more prepared. I come this. I mean, one of the questions came to us. How can we raise adult literacy through the media, especially during acute event like this one? I think this is from Shahrazad, from a name called Shahrazad.
Well, I read one article about who in the community who is following the guideline. I mean, the prevention steps and these things, and they found out that the adult male patients are the least who follow the advices and the preventive procedures. So I think we should work very hard on this category, the adult, and mainly the males, not the females. The females, they listen much better than the males in following the preventive procedures and the what is being told to do to avoid spread of the infection. So
Hassan disagree that the female listen more than the male.
They listen only when they need something only.
Let us keep this aside.
No, when they need something in health issues. Don't go far, bro. But
before I go to Hassan, because that health literacy important, what is the role of family medicine in this? Because I see there is a huge role in family medicine. You are trusted people. Actually, you are the first contact. You are the people responsible for continuity of care. You are the people who take care of our health, dealing with diseases and especially chronic diseases beautifully. So what is the role? And you are a leader in family medicine in Kuwait and the Arab world.
Actually, although COVID-19 is something not good for the public and for the population, but actually we are seeing a good positive things from having this COVID in changing the attitudes and improving the policies in our center, and also in better communication between the doctors and the population. I mean, before the COVID, usually the patient, they come to the center without appointment, and the continuity of the care, it was not there, and the patient abused the system. The patient, they don't listen to the doctors, they don't trust the doctors. During the COVID, now the appointment procedure is the clinic is very well implemented, and the doctors are now in continuous relationship with the patients through the teleconsultation, and especially the chronic disease. So that teleconsultation and the continuity of the care and the appointment system and WhatsApp discussion with the patients and online discussion with the patient, video consultation now we are using, all of these things build a very good doctor-patient relationship. And at the same time, the patient now, they listen to the doctors more for carrying on prevention. Not only that, the community now, they go more on Instagram and the online for the center itself, and they take the information from this center and they listen for this center. So we found a positive effect of the COVID-19 on our community than the campaign that we are doing it before having this COVID.
Hassan?
Okay, Doctor, it's very, Prof. Salman, it's very good chance in this COVID or this pandemic situation to concentrate on health education. For the last 100 years, Arab countries, I'm talking about Arab countries, Western, we are concentrating on giving Panadol, Vivadol, antibiotics, treating. We don't concentrate on preventing.
We concentrate on illness, not prevention, promotion.
Yes, we need to concentrate now. We got very good chance for health education. We are now using social media. We are using internet. We can use it in better way for education. Education. If I get 10 chances, I will put first 5 for education, second 4 for prevention, and then last the 10th one for treatment. We will get better with these things.
I know our colleagues in Qatar, which we could use as a example. They are developing a health literacy program formally within the Ministry of Public Health. And I'm sure there are similar examples in the other 21 countries, which we need to bring it up and we learn from that experience. And maybe we should dedicate a session on how to improve the element of prevention, promotion, health education, because it's the time. I mean, that maybe we never thank COVID for anything, but at least this is one of the challenges of COVID, that we look at ourselves in different way, because these sort of pandemics will not end by this one when we totally control it, and we will. But certainly it is something that will be more often in the future. And what COVID has identified in terms of the weaknesses and lack of resilience in our health systems is now well known. But among these, and the most important element of these weaknesses is the weaknesses of public health, because countries did not invest sufficient enough in public health. And really, to save life, now we know, and this should be the slogan, to save lives, we need to have public health. And public health must be integrated with the primary care, both in education and training, as well as in service delivery. There is a question from Professor Yahya Al-Khalidi, and this is about return to school. What is the role of the information system and إدارات التوعية الصحية, health information system, in raising the awareness about returning to school and the impact of returning to school? As you know, I mean, this is really a very good question, because many countries are concerned that in the middle of this month, in some countries on the 11th of August, children will go back to school. There is a lot of fear now that the spread of the virus will be accentuated with the return to the school, simply because these will bring the infection to their families and so on and so forth. Dr. Huda?
Well, I think, although this is a very good question, at the same time, it is very difficult to answer this question because you are talking about attitudes and behavior, and you cannot guarantee how much you can control this behavior and attitudes among the population, and especially if you are talking about the children. How can you control them, and how can you make sure that you are implementing the preventive procedures when they go back to school? Well, there are something good for them to, if they return to the school, but there are something very bad for them if they go back to school. I think this is very difficult. It needs the collaboration of the health center in the same area for the school, where they can collaborate very well together with the school in order to put a plan, very good plan, how they can control the behavior of the teachers, the parents, and the students in implementing the preventive procedures, and making sure that continuous health education and observing them and measuring exactly whether it's implemented or not, in order to succeed. I mean, they have to return one day. They have to. So, and we don't know when it will finish, this COVID. So
By
now
the way,
you will go on.
This is what Dr. Hassan said. You're absolutely right. And I think there are a lot of people calling to trade-off between locking something else and allowing the school to go first. If any group need to go back to normality, it should be the school. But that mean also should not ignore the public health measures. Many of our schools are overcrowded, you know.
But Prof,
The rich country. Carry on, Hassan. Sorry.
Salman, you know, I don't know how I can say it in English. رب ضارة نافعة. This is an excellent, a very good, excellent chance for our people to educate the children about school, how to behave, how to wear mask, how to be away, distancing. This is, we can't teach them in the last 20, 50 years. No one teach us how to be away. We are using the same food, the same things. Over now, it's very good chance by force. اللي ما تعلم بالطيب يتعلم بالخوف من كورونا. He will be very good in way of dealing with his friend. He will not cough in front of his friend. He will not sneeze. He will wear mask. He will use his own tissues, everything. This is good chance. They have to go one day. If not next month, after that, we will not stop them. The life is going on. It's not only a health life. We have economy, we have political, we have a lot of things. So we have to, يعني يجب أن نتعايش مع الفيروس.
Yes.
يعني خلاص مقرر علينا. يعني زي الزواج. We have to.
So living with the virus, I like this. You know, this is good analogy. But living with the virus is a very important point.
Yes, والأولاد يتعلموا. It's chance for children to learn how to behave healthily. No one teach them. You know, الواحد ياخذ المطارة حقه حق المويه ويروح يعبيها من أي بسبوس ويمشي. الآن he's worried because Corona will appear. Now he's worried because he uses his own pen, his own pencil, everything with protection. So this is a good chance for children.
Yeah, we have last 3 minutes, and I want to see. This is a very good point, Dr. Hassan, and really we should think about it carefully. Therefore, we have to manage, to answer Dr. Yahya, Professor Yahya, we have to manage the process of return to the school, and we make it fully educational and learning experience to protect our children and protect the rest of the society. But this is a very good point. The last few minutes, I just want to focus about the second wave. And how do you think the media should really behave, whether it is the formal media or the informal, the social media? How can we make sure that colleagues, by receiving any information, they just suppress it and send it to 1 million people? And with it, they said, if you don't distribute it to 10 people, you will die within 10 minutes. I just want to hear from you, you know, as people with such a vast experience, how should we behave? Should we have more control? Should we have some educational program to the people on the use of the media?
Okay. If Dr. Huda allow me just one thing, we should deal in the second wave or from now and then مبدأ ولو كنت فظا غليظ القلب لانفضوا من حولك. يجب أن نبشر ولا ننفر. We scared them for the last 6 months. They are scared all the time. We have to find a new way how to educate people. يعني بالتي هي أحسن. We have to educate them, tell them about the virus, tell them the truth, find a good channels to reach people in every place, in every village, in every city with good way. Not only make them scared all the time. Be scared, our immunity will be low and we will die before the virus.
Yeah. Last 30 seconds, Dr. Huda.
Prevention, prevention, prevention. Education, and nothing else. So don't use the media only for prevention and education, and don't explain about the disease. Only education and prevention.
Yeah. I think this is a very valid point. Nevertheless, people will continue to be interested in treatment because we need to be truthful, as Dr. Hassan said, that there is no treatment, no new treatment. We are using supportive treatment and what available treatment which may fit to X number of people, i.e. certain percentage of people, but not for everyone. We don't have any means for prevention, a vaccine. It may or may not be available. It may be available and the virus may change. It may be available, but not widely distributed. Rich countries may get it, others will not. So even if available and 100% safe, it will not be easy to be distributed everywhere in the world. At last, but certainly not least, I would like to thank you very much indeed, Huda and Hassan, Dr. Huda, Dr. Hassan, for making it such an enjoyable webinar. Actually, we are sorry to miss two colleagues, Professor Khoja and Dr. Ahmed Rudaini. We hope we will meet them soon. I would like to thank everyone for being with us today. And I know a lot of people asked a question. I apologize that we couldn't answer all the questions. Next week, we will have a webinar on actually public health competencies with the president of the Faculty of Public Health from the UK of the Royal College of Physicians, and Sheikh Mohammed Al-Thani, Dr. Sheikh Mohammed Al-Thani, Director of Public Health at the Ministry of Public Health in Qatar. He's a founding member of the association. Last but certainly not least, I just want to finish with a word on Lebanon, and we wish our people in Lebanon peace and tranquility in this difficult time. Trust us, we are with you at every step, and we never hesitate to give anything to support you. And I know all the governments in the region and all the governments in the world are supporting you in this difficult time. Thank you very much. Good evening, good afternoon, good morning. Thank you.
Thank you.